Arthroplasty. Arthroplasty is a surgical procedure performed by an orthopedic surgeon to restore the integrity and function of a joint. Hip and knee arthroplasties are the two most commonly performed surgeries. Arthroplasty can repair or replace any joint in the body, including the shoulders, elbows, and ankles. Arthroplasty is surgery performed to relieve pain and restore range of motion by realigning or reconstructing a dysfunctional joint. Various types of arthritis may affect the joints. Osteoarthritis, a degenerative joint disease, results in a loss of the cartilage or cushion in a joint and is the most common reason for arthroplasty. There are two types of arthroplastic surgery: resection arthroplasty and interpositional arthroplasty. Joint resection involves removing a portion of the bone from a stiffened joint. Interpositional reconstruction is surgery to reshape the joint and add a prosthetic disc between the two bones forming the joint. The prosthesis can be made of plastic, metals, or ceramic material. When interpositional reconstruction fails, total joint replacement may be necessary. Total joint replacement involves surgical replacement of a problem joint with a prosthesis. Joint replacement is also called total joint arthroplasty. Indications: arthroplasty is performed on people suffering from severe pain and disabling joint stiffness. Joint deformity, pain, swelling, and stiffness on weight-bearing joints and locking of the joint are the other reasons. Preparing for arthroplasty surgery. Arthroplasty is a major surgery. In addition to a complete medical history, your doctor may perform a complete physical examination to ensure you are in a good health before undergoing the procedure. Your doctor will assess your joint's level of mobility and your ability to perform self-care tasks. Every case is different and different surgeons may have different procedures. This is something that will have to be determined based on the extent of the surgery. If you are considering or planning arthroplasty, consult your orthopedic surgeon for the best advice on your case. Your doctor will explain the procedure to you and offer you the opportunity to ask any questions that you might have about the procedure. Notify your doctor. You will most likely recommend quitting a month prior to surgery. You need to sign a consent form. A smoker, doctor will most likely recommend quitting a month prior to surgery. You need to sign a consent form that gives you a permission to do the procedure. You may undergo blood test or other diagnostic tests. Diagnostic testing will typically include X-rays of the affected joint, CT scan, MRI, and bone densitometry to assess bone loss or bone infection. Cardiac tests such as electrocardiogram to evaluate the heart function, blood and urine tests to rule out infection, anemia, and if you have a history of bleeding, the surgeon may ask that clotting tests be performed. Weight loss may also be recommended if you are overweight. Anesthesiologist will discuss any special conditions that may affect the administration of anesthesia. Surgery will not be performed if infection is present anywhere in the body or if you suffer from any heart or lung diseases. If surgery involves deep tissue and muscles such as total hip arthroplasty, the surgeon may order units of blood to be prepared in case transfusion is needed to replace blood lost during the surgery. Your surgeon may ask you to begin strengthening exercises few weeks before the surgery. Arthroplasty requires a hospital stay. Fasting is required for at least 8 hours before the procedure, generally after midnight. Your doctor may prescribe a sedative prior to the procedure to help you relax. Based on your medical condition, your doctor may request other specific preparations. During the procedure, arthroplasty requires, for example, in an arthritic knee, the orthopedic surgeon. You will be given an anesthetic and the surgeon will replace the damaged parts of the joint. For example, in an arthritic knee, the damaged ends of the bones and cartilage are replaced with metal and plastic surfaces that are shaped to restore knee movement and function. The materials used in a total joint replacement are designed to enable the joint to move just like a normal joint. The anesthesiologist will continuously monitor your heart rate, blood pressure, breathing, and blood oxygen level during the surgery. Postoperative care. Immediately after the surgery, you will be taken to the recovery room for observation. Once your blood pressure, pulse, and breathing are stable and you are awake, you will be taken to your hospital room where you will stay for several days. You will be given pain medications to relieve pain and antibiotics to prevent infection. It's important to begin moving the new joint after surgery. Early mobilization of the patient is thought to be the key to reducing the chances of complications such as venous thromboembolism and pneumonia. A physical therapist will plan an exercise program for you. It's the most important aid to recovery and may continue for several months. Activity may be resumed gradually using devices if necessary, such as walkers or crutches, as recommended by the physical therapist. Depending on the type of arthroplasty you have, your full recovery can take up to 4 months. Your doctor will evaluate you and you will be discharged home or to a rehabilitation center and will arrange for continuation of physical therapy until you regain muscle strength and a good range of motion. Aftercare. Following arthroplasty surgery, you must be careful not to overstress or destabilize the joint, requiring rest at home for a period of weeks. Once you get home, the surgical area will need to be kept dry and clean. You will be given instructions on bathing. Stitches will be removed when you go for your follow-up visit. Orthopedic surgeons follow up with you at regular intervals after surgery with a physical examination and x-rays or other types of imaging. This process helps ensure the arthroplasty procedure and devices are performing as expected. To help reduce swelling, you may be asked to elevate your leg or apply ice to the surgical joint. Take a pain reliever for soreness as recommended by your doctor. Be sure to take only recommended medications. Avoid driving and other strenuous activity until your doctor tells you to. It's important that you avoid falls after the arthroplasty surgery because a fall can result in damage to the new joint. Your therapist may recommend an assistive device to help you walk until your strength and balance improve. Full recovery from the surgery may take several months. Benefits of arthroplasty surgery. Arthroplasty can drastically improve your quality of life and help you to enjoy the activities you previously enjoyed, including walking, running, swimming, and so much more. The surgery is generally safe and very few people experience complications. The following are the benefits of arthroplasty surgery. Improved range of motion and use of a joint. Arthroplasty surgery can replace or stabilize the joint, allowing you to stand and walk and move your body easily. Pain relief. Surgery can relieve pain that doesn't respond to other treatment options. Improved alignment of deformed joints and improved functioning. Making certain lifestyle changes may help you during your recovery. These modifications include proper handrails along all stairs, safety handrails in the shower and bath, use of special seating or sleeping surfaces, raised toilet seat, reaching stick to grab objects, removing loose carpets and electrical cords, employing home care assistant for help with shopping, cooking, and household tasks. In doing so, the goal is to relieve a person's pain, restore range of motion, and help her to walk better and improve the strength of the affected area. Risks of the procedure. Arthroplasty carries the same risk as other major surgeries, including bleeding, infection, fever, chills, redness or swelling, continued pain or stiffness, blood clots, nerve injury, loosening or wearing out of the implant. The joint may have to be replaced again in the future, and fracture. There may be other risks depending on your specific medical condition. People at risk for complications are those who have heart problems, diabetes that's not well managed, and weak immune systems. Be sure to discuss any concerns with your doctor prior to the procedure.